I'm going to be talking this morning to Dr. James Talbot. He's the former Chief Medical Officer of Health in Alberta, now an adjunct professor at the University of Alberta. And he and a colleague, Dr. Noel Gibney, who's also at the University of Alberta, have written several letters, one to open letter to Albertans and the other an open letter to Premier Jason Kenney about the COVID-19 situation, the crisis in Alberta. And he has some very pointed criticisms to make of the government. So welcome to the interview, James.
Thanks for having me.
Look, I want to read a paragraph from your second letter that is very striking, and because it is essentially, without saying it, seems to accuse Jason Kenney and his government of following the Great Barrington Declaration, a much reviled and criticized document. So let me read it and then I'll get you to respond. It is clear from the actions of the government of Alberta and the Premier that their callous strategy is to stand by until enough Albertans have contracted COVID, become ill, and then hopefully recovered to get to the point where there are too few Albertans without immunity for the COVID virus to find new victims. Your reaction to the Great Barrington Declaration comparison?
Well, I think it's fair that I don't like talking about the Great Barrington Declaration because it gives it more credit than it deserves. It was a couple of second-rate academics in a small town in the northeastern United States putting forward a strategy that said, let's just stand back and let the virus infect who it will and accept 2 to 4% mortality. And besides the science being bad, when there are things that we could do to prevent that, it's morally and ethically bankrupt to pursue that strategy. Where we drew the comparison with what the Kenney government is doing is that they've said that they will do nothing more to try to stop transmission in the community. They're not doing anything more in terms of increasing the effectiveness of getting more people immunized. So in effect, they are standing back and waiting for the virus to hunt down the people that are still vulnerable to it and either kill them, or if they recover, then they'll be immune. And so we thought the comparison was apt.
Now, a little wrinkle on this, James, because I've heard, if I remember correctly, I think Dr. Bonnie Henry in BC said something along these lines. And it seems to be that public health officers are trying to do the minimal amount of intervention in order to provide the most protection. And they keep backing off from intervention. And then we have another wave, a wave of COVID-19 infections, and then they put interventions back in place. What's your take? You know, you've been the CMO for a while, and I mean, you're clearly an expert in public health. Is this a principle of public health? What's your take on it?
Yeah, I think the principle is to try to provide the maximum of protection with the minimum disruption of personal liberty and the economy. And there's no question that when economies suffer, people suffer, and that's something that public health wants to prevent. I think you've seen in the territories and in the Maritimes a group of people who've pursued a COVID-0 strategy and been very successful. They've been world class on that. And I think Alberta and Saskatchewan, they did well in the first wave. They did reasonably well in the second wave. And the third wave, Alberta started to really flirt with this idea of intervening late and abandoning precautions early. And it's been since then that we've seen these wild swings out of control. And the one thing that I heard consistently from Albertans throughout is that they did not want to go on to a series of waves and troughs, that they were really against anything like that. And so they wanted slow and steady. And that is not what they've gotten since November of last year.
Now, in your 2 letters, you've set out some 7 measures that you recommend the Alberta government pursue. They include transfer patients to ICU facilities in Ontario, increasing immunization with vaccine passports and employment mandates, restore contact tracing, and limited measures to prevent indoor transmission. These seem to me to be all, common sense, if I may say, minimal kinds of interventions. Would you agree with that?
I would. I mean, I think what we're trying to get across is that we have the highest transmission of COVID in the community of any province in the country, coupled with the lowest immunization rates. And we have killing pressure, literally killing pressure being applied to a healthcare system on which we all depend. And so that requires some kind of understanding that status quo isn't good enough. And so, we have not suggested a lockdown. The Premier basically totally mischaracterized what we were saying. We were saying the transmission happens when you're indoors without a mask for more than an hour at a time. So let's look at shutting those places down again, moving dining and drinking outdoors again, which we can still do in the fall. We said that, vaccine passports being made mandatory has been already tried and shown to be effective in BC, Ontario, Quebec. There's no reason why they can't be implemented that way here. And similarly, the government took the first step, a very small step, by making vaccines mandatory for Alberta government employees, but they could be requiring or recommending it for the rest of the province. What we have now is a piecemeal approach in which Edmonton and Calgary and Lethbridge have stepped up to the plate as governments. A number of large businesses have stepped up to the plate to say, we want to protect our customers, we want to protect our employees. But, and I praise them because that shows real courage. But it would be a lot more effective if the government basically said, we're going to do this province-wide. And until we do that, I don't see the stress on the healthcare system coming off. And I see us continuing to lose 10 to 15 Albertans a day, 100 a week, which is where we are right now.
James, is it, you're an expert on public health. Have you ever seen a pandemic mismanaged like this? Are there case studies where governments have mismanaged as bad as Jason Kenney's government?
Yeah, unfortunately, I think even in this pandemic, you can point to jurisdictions that have gotten every step of it wrong. The first wave in Alberta was dealt with quickly and effectively, and as a consequence, we actually outperformed a lot of Canada in terms of keeping mortality low. Second wave did okay, not that great, could have got it under control quicker. Third, again, toyed with bringing down the healthcare system, pulled up at the last minute, and it's really this last one that they've blundered on. But you can point to jurisdictions like Florida, for Texas, Brazil, India, the USSR, former USSR, now Russia, even places early on like the UK and Sweden, Italy, and France, where there was far more mismanagement at some point. Brazil has been just an object lesson in what not to do. So there are places that have handled it worse than Alberta, but right now there's no place in Canada that's handling it worse.
Small consolation to Albertans to know that other governments are as incompetent as Mr. Kenney's government.
Well, yeah, I don't think a lot of Albertans would feel comfortable saying, hey, we're doing just as bad as Brazil and Russia.
Look, I want to ask you a follow-up to your comment about limited measures to prevent indoor transmission, because that gets us to the issue of the science around the airborne aerosol transmission of COVID-19. Where do you fall down on that particular issue?
I think I'm somewhere in the middle. A long time ago in public health, they realized you were always going to be in situations in which the science was evolving and people would set up these kind of controversies as a false dichotomy, that it was one thing or the other, that it's either droplet or it's aerosol. And I think there's pretty good evidence that droplet is still the major way that it's transmitted. It's the one that we have to be the most careful of. But I think the physics is pretty compelling that aerosols are a potential means of transmission, and that they're particularly important indoors, and particularly where ventilation and filtration are poor, and that you can end up with people being infected at greater distances than the meter that droplets can infect. And I think the game changer for that one is going to be the N95 masks. before this happened, you couldn't really recommend N95 masks, which are protective against aerosols, to the general population because there just weren't enough of them and they were too expensive. But now, as one of the few bright lights of COVID, that manufacturing capacity has skyrocketed. And so I've been recommending to friends and family for a couple of months that they need to upgrade to an N95, which gives you personally more protection. And, we've also advocated for that in public. And N95s get their major increase in protection around people who have aerosols, although they also provide an additional level of protection against droplets. So I'm kind of in the middle. I still think droplets are the major way that people get infected and get serious illness, but aerosols can contribute, particularly indoors. And then N95 masks are a good thing to get your hands on.
Given the pressure that's on the Alberta Health, the acute care system, the Alberta Health Services still isn't recommending N95s for healthcare workers that are working in COVID wards, only for aerosol generating procedures. Do you think that they need to update that guidance and get everybody who's potentially exposed to aerosols in a hospital wearing N95s?
I don't want to second guess colleagues who are putting their lives on the line with the recommendations that they make. And I'm not someone who's comfortable putting myself as an expert on all aspects of infection control. But I think that we've gotten to the point where particularly if you were in hospital and you're unimmunized as an employee, if I were in that situation, I would seriously consider buying my own protection. I mean, they're not that expensive, and of course, I would not be unimmunized, but if I were, I'd at least want to protect myself and my family when I went home. So, I mean, I recommend it personally. What the organization decides to do is more complicated. They have to take in a lot more factors, including the cost of that for 100,000 employees. But I think that you will see after COVID is over that more and more people are going to move to the N95s as the standard for protecting themselves and other people.
Fair enough. In your letter, your second letter, you called on the government to release the data that it uses for predictive modeling. You called on them to release the predictive modeling analysis. And I interviewed Dr. Gosha Gasparovich from University of Calgary and a few other modelers around COVID. Dr. Gasparovich was withering in her criticism of the Alberta's modeling. She's called it incompetent. So is it important to post this information so that other modelers can check it and we can have a debate about it rather than keep it secret?
Yeah, I kind of thought that that's what a democracy was about. You have 80% of people in the province who voted with their arms to say that they want to get out of COVID and they want to do it by being immunized. In the meantime, the government is not, as we've already covered, isn't doing anything substantial to get to that place. And so we have two things happening. We have people continuing to die at an unacceptable rate, a significant number, but not all are unvaccinated. And the second thing that we have is this killing stress on hospitals that's meant the cancellation of elective surgeries. It's soon to be at the point where even life-saving surgery may have to be rationed. That's what a triage is about. And we're doing this on the basis of a government that feels confident that they can weather the storm. Well, first of all, you need informed consent if you're going to conduct an experiment on the Alberta population. And the only way you can do that is by showing them the figures. And it's not, the government likes to make this complicated. It's not. What Albertans would like to know is how many more Albertans are going to be dead before this thing runs its course? How many more elective surgeries are going to be canceled? How many people are going to be deprived of the ability to get the normal services that they would get, which are now being sucked up by this clogging up in the healthcare system of unvaccinated people. So how long is this going to go on, and how many people are going to die or be seriously affected by that decision? And the government has two choices, really. They can admit that they don't have that data, in which case they're incompetent, or they can release the data and the assumptions and have the various experts we have look at it and say, this is reasonable or this is not reasonable.
Well, the modeling that supposedly preceded Premier Kenney's declaration that the pandemic was over in June and that we're going to have the best summer ever, and then they had to admit that the modeling was based on incorrect UK assumptions, and then did nothing after that. I mean, that really bolsters your case, doesn't it?
It does, but I think something that the premier's admitted to is even stronger, which is that in August, they actually, as they modified their model, they saw that it was tracking high, meaning that it was going to be the most severe case that they had thought it was. And if you cast your mind back to August, we still had relatively low transmission in the community. And they could have done something at that time by bringing in some of the things that they brought in later, or they could have let Albertans know so Albertans could make the choice and say, you know what, I'm not that comfortable with the new vaccines, but the government says this is going to be a very bad surge, so I'm going to go get immunized anyways. But by denying people the opportunity to look at the data, they denied them the opportunity to make good choices for themselves and their families. And I think that's reprehensible. I've used this before, but I don't know, depending on how old the audience is, how much it resonates. But when Canada had decision makers who made bad decisions about protecting the blood supply and ended up with HIV and Hep C being transmitted and making people sick and killing them, they held a commission afterwards, a national commission, the Creever Commission. And Justice Creever, in his report, made a very strong case that if you're a government official who makes a decision in this kind of situation, you need to be able to ask three questions. What did you know? When did you know it? And what was your duty? And it was the duty of the Alberta government in August to let people know that their projections showed that this was going to be a very bad fall. And they did nothing.
Now, I want to ask you a more broad question in the same vein, and that is that there seems to be a trend, and particularly you can look west to British Columbia, where Dr. Bonnie Henry, the public health officer there, is being criticized for not releasing enough data, maybe even fudging data. The UBC is not releasing data, so universities are. There's a sense this time around that the public health officials are not releasing enough data for people to make personal risk assessments, like as you just described. Is this unusual during this pandemic?
Well, I can't comment on BC. I mean, I think overall BC has operated closer to the science, significantly closer to the science than Alberta has. In Alberta, though, I can say that, we made requests back in July that the modeling be made available. Multiple media outlets questioned the government repeatedly on this. At some point after this is all over, there's going to need to be a discussion in public about how the decision to suppress or not release information is made in a free society. And I think one of the things that I would like to see, and I have seen this happen before when I was chief MOH, this was one of the ongoing issues. It's that both the civil service and the government officials I was dealing with wanted to release less information than we did, and particularly if it looked like we weren't winning. And I understood that, but we fought very hard for the idea that in the end, the public makes good decisions and they need to trust you, and they can't trust you if you're hiding things from them. And I don't recall ever losing that battle. So that battle happens regularly. But the one thing that I would like to see is that anytime a public health emergency is called, that the chief MOH ceases to report to the premier and instead reports to the legislature as a whole. And I had made that point and lost it in previous emergencies when I was in government. But my reasoning was that real emergencies affect everybody. They don't pick and choose on the basis of political party. And real emergencies need a whole of society response. They need us all to pull together. And so one of the ways you can concretely demonstrate that as a government is to say, no matter what party you are, we're all going to hear the same information together. We're all going to be party to the ways that the decision-making is being made. And if new data comes in to show that we were right or that we were wrong, we will be sharing it with all of you. And, there's lots of precedent going back to the Second World War and other major things that threatened Canadians. We're moving towards that open, transparent, all of government approach is a much better way than leaving it to a party, which in the case of Alberta has been in thrall to a fringe, an extreme that it is clear the majority of Albertans disagree with.
Let's wrap up this interview with what may be, and I appreciate the fact that this question is a bit difficult for you to answer, and that is the performance of Dr. Dina Hinshaw. And she's been criticized for making a number of mistakes, particularly around the modeling using UK assumptions. What's your take on her performance?
So let me just start off with a caveat that whatever decisions are made in Alberta, they're about public health, they're ultimately made by the minister and the premier. So I know what the minister and premier think, and because I can look at their actions, and I feel comfortable, as do my colleagues, criticizing them on whether or not they're following the science and what they need to do better. With Dr. Hinshaw, I don't know what to say because I've not talked to her personally. I don't know what she's recommended. I don't know what kind of pressure the government has put her under. I would say that I think Dr. Hinshaw's first wave performance was excellent, and most Albertans agreed with me. I think the second and third wave were good, but more mixed, and the third wave in particular was worrisome in how late they brought in the restrictions that actually made a difference. And then the fourth wave with the Delta being allowed to become dominant, and then starting this fourth wave and now on the verge of crashing the healthcare system. I think that performance has not been good. And but as I said, I can't tell what parts of that are Dr. Hinshaw and what parts of that are a government that has shown a real capacity not to listen to good advice.
Well, this will be my final question. I've interviewed a couple of professors of law, public health law, about this issue 6 months ago, and they pointed to the Alberta Public Health Act and a section, I forget which section it is, but that says that the chief medical officer of health actually has the power to act. It doesn't need the approval of the cabinet or the premier or anybody. The CMO can act on their own in the case of a public health emergency. Now, you've been in that situation. What's your take on how that act is interpreted?
So a couple things about it. I think it still requires an order in council. So it requires the lieutenant governor to approve it. And the lieutenant governor would take the counsel of its government before it moved forward. But, and the reason I'm hesitant is that a state of public health emergency has never been declared with the opposition of the government. So and I'm not a legal scholar. Leaving that technical part aside, most of the times that the act was envisioned as being used, it was thought to be a short time limited thing, and it didn't take into account that we'd be 18 months into this and still having to make emergency decisions. And so it is true that under the emergency powers that Dr. Hinshaw can act independently. If the government refused to support the actions that she was taking, then her only action left would be either to wait to be fired or to resign. And I think there were many times in the last 18 months where Dr. Hinshaw would have looked at that and said, you know, whoever comes after me could be worse. I'm going to do my best to try to make sure as many Albertans make through get through this as possible. But I think, you know, she is the one who has to make the decision as to whether or not this is important enough to publicly disagree with the government. And the other problem is that the moment that happens, confidence in the response is going to plummet. And no matter what happens to Dr. Hinshaw, the government's ability at that point to speak with any kind of moral authority will have disappeared right at the moment where we really need the government to make better decisions. So, yeah, I think I used to talk about that power of the act as being the honeybee part of the act, because you get to use that sting once and that's it. You know, after that, the honeybee isn't going to survive. So it is a very important power to be able to use, but it's also one that comes in with something that's much more complicated than I don't like what's happening and I'm going to make clear to the public I disagree, and so I'm just going to resign.
Well, Dr. Talbot, thank you very much for these insights. I think that you've provided Albertans and Canadians with a real inside take on what's going on in Alberta. We wish Albertans all the best. Thank you very much for this.
Thank you.